If states want to mandate, I think it's not a good policy, but they can do so constitutionally. And then if a person's tired of paying those kind of premiums, you can move to another state and vote with your feet. There are some states in the union here that I would move out of because they can't afford the health insurance in them. There are other states one could think about moving to because of the opposite. They always tie this pre-existing conditions in with the word discrimination because it's like a civil rights code word. So if an insurance company says, I don't want to provide insurance policies to people who have pre-existing conditions, who wait until they get sick before they buy a policy, the health insurance purchasing equivalent of waiting for your house to be on fire before you go buy property and casualty insurance, how many rational people, Mr. Speaker, in this country would make the case that we ought to have a guaranteed issue for our fire insurance on our house? Couldn't we then just, set up our little BlackBerry with an automatic send and wait for the fire alarm to go off, and on the way down the steps to bail out of the burning house, you can just click send. Automatically, they'd have to give you a policy so that your house could be rebuilt and if it's on fire. We wouldn't do that. Now, I know there are Republicans that support the idea of insurance policies being extended to age 26, but Mr. Speaker, what a lot of people don't know in this country is that there are at least 2 members in this Congress that were elected before age 26. And had Obamacare been implemented before they were elected to office, they could have been on their parents' health insurance plan. Now, isn't that a nice thing when you wean them off of the parents' health insurance plan and you transition them over and put a pin on their lapel and say, now run the country? They haven't had a single minute of their own health insurance policy until they get here. And actually, we have a responsibility for it here. We pay our chunk of the premiums like any other federal employee. But I just think it's ironic that there would be such a strong argument that people elected to Congress could come here, walk in that door, come down here before the Speaker's rostrum, raise their hand and take the oath of office, and at that moment still be on their mommy and daddy's health insurance policy.